Canada's chief public health officer says this country is at a critical point. Over the last week, hospitalizations for COVID-19 increased by 7%. The number of critical care patients jumped by 23%. Ontario appears to be in deep trouble. More than 4,200 new infections were reported there today, and 18 more people died from COVID-19. Ontario hospitals have been instructed to postpone elective and non-urgent surgeries to ensure they have the capacity for COVID-19 patients. Quebec, Alberta, and BC are seeing similar spikes in case counts. Manitoba said today it's at the start of a third wave. And as Mike Le Couteur reports, Canada's chief public health officer says tighter public health restrictions are essential.
Right now, put the brakes on. Get this curve under control.
Canada's top doctor couldn't put it any simpler. Dr. Theresa Tam says the modeling shows we are headed in the wrong direction as variants spread quicker than vaccines are going into arms. So she's imploring Canadians to respect public health guidelines.
The faster you get on with these measures, the faster you can come out of them.
And it could go even faster as the vaccine rollout ramps up across the country.
I'll look the other way. Okay.
A needle-nervous Doug Ford rolled up his sleeve today. The Ontario Premier urged people to follow the stay-at-home order while they target so-called hot zones with vaccines.
Where we see 60% of the cases in Toronto, Peel, and York, we have some issues in those areas.
The rollout has been criticized in those regions.
I feel like I am doing the government's homework.
Ray Lai volunteers his time to help people navigate Ontario's vaccine booking system. He's also taken to Twitter, calling out the province's rollout.
I honestly don't see a plan. It is policy by press conference. It doesn't do anybody in this province a service at all. And it causes general anxiety.
That anxiety made worse by a directive for Ontario hospitals to ramp down elective and non-emergency surgeries as they prepare for an increase of COVID-19 hospitalizations. And it has the president of the Canadian Medical Association worried.
People in their 30s, in their 40s, who are now being admitted to ICUs, and also who are dying.
Dr. Collins believes COVID-19 variants have completely changed the ballgame, and it's why now more than ever, people need to follow public health guidelines. Mike Le Couteur, Global News, Ottawa.